My name is Morgan Castle, and this is my head-to-toe assessment. This is Tessa Castle. She is a 39-year-old female. She's 5'6" and 200 pounds. Her appearance is clean, and she appears well-nourished, and her affect is appropriate. Looking at her face, she has normal facial expressions and symmetrical movements. So we start off by looking at the skull. Her skull is normocephalic and symmetrical. There are no patterns of hair loss. And then just let me know if you have any tenderness.
No.
And there are no tenderness, lumps, or deformities of the skull. And then we'll move on to her eyes. We'll test for accommodation first. So I'm going to have you look at this, and then I'm going to have you look at the wall behind me. Okay. And then we would do the Snellen chart, which I don't have one, so you would have her stand 20 feet away from the chart, have her read the smallest letters possible with both eyes, and then cover one eye and have her read the lowest line possible, and then have her cover the other eye. And then you would also note that she does wear corrective lenses. And then we would move on to the ears. So there are no deformities, erythema, or any lesions noted of the ears. Oh, and then also for the eyes, you would test, I'm gonna have you take your glasses off. Her pupils are a +2. So her pupils are equal, round, and reactive to light and accommodation. And then back to the ears. So at this point you would get the otoscope, pull the auricle back, and look inside the ear canal for any foreign bodies like earwax, any swelling, or any kind of drainage. And then you would look at the tympanic membrane. In the right ear, the cone of light should be at 5 o'clock, and in the left ear, it should be at 7 o'clock. And then for a hearing test, you could do the Weber test, which is where you put the tuning fork in the middle of the head or the bridge of the nose and ask the patient in which ear they are able to hear it best. And then also the Rhine test, which is where you put the tuning fork over the mastoid until they can no longer hear the sound, hold it out next to the ear, and then see if they're able to hear the sound again. And then we'll move to the neck. So first we'll palpate the lymph nodes or the frontal sinus. Is there any tenderness in your lymph nodes? Okay, so there's no tenderness reported. Her trachea is midline. And then for the thyroid gland, it should be symmetrical with no tenderness or nodules present. And then you can stand to the side and have them swallow. And the thyroid does move up and down with swallowing. Her nose is symmetrical. Have you tilt your head back? The nares are pink and moist with no lesions or swelling noted. And then move to the throat. So I'm going to just have you open your mouth and say ah.
Ah.
Stick your tongue out. I'll say ah.
Ah.
The tongue is midline. The uvula is midline. The pharynx is pink with no swelling or lesions noted. And then her tonsils are +1 bilaterally. And then moving on to cardiovascular, I'll first check her radial pulses. Her radial pulses are 2+ and equal bilaterally. Let me check your dorsalis pedis. They are 2+ and equal bilaterally. And then for apical pulses, we'll check carotids. Her carotids are 2+ equal bilaterally. There is no jugular vein distension present. And then cap refill. You see your hands. Her cap refill is less than 2 seconds bilaterally. She does not have any edema present in her lower extremities. And then I'm going to listen to your heart rate. Her heart rate is, she has a regular rate and rhythm, no murmurs, gallops, or rubs, and S1 and S2 are heard. And then respiratory, her rate and depth are normal. There is no use of accessory muscles, no retractions, and no sign of distress. Her color is normal for ethnicity. There is no signs of cyanosis. There are no signs of trachea deviation. And then her AP diameter is 2 to 1. You could also do tactile fremdus if it's indicated at this point. And then I'm going to listen to your lungs, okay? Her lungs are clear to auscultation in all fields bilaterally. So moving on to the abdomen, her abdomen is flat. She does have a cesarean section scar and scars from previous laparoscopic gastric bypass. There are no lesions or rashes present. We'll start by auscultation. Her bowel sounds are normoactive in all 4 quadrants. And then we will listen for bruits. There are no bruits heard in her aorta, renal, iliac, or femoral arteries. You could test for ascites. You do this by shifting a fluid wave by percussing outward from the central area. And then you map the difference between tympany and dullness. And then you do that again with the patient lying on their side. When there is no ascites, the tympany and dullness stay constant. And then we will do her liver span. And her liver is about 6 centimeters. And then for splenomegaly, you take a deep breath. And there is no sign of splenomegaly. And then for appendicitis, we can do the Rovsing sign. So let me know if you feel pain on the right.
No.
She has a negative Rovsing sign. The PSOAS sign. So this is whenever you flex your right hip. Or anything in this? Okay, that's negative. And then the obturator is whenever you bring this knee up and then you do an internal knee rotation. Does that have any pain?
No.
Okay, so she has a negative obturator sign. And then for cholecystitis, you can do the Murphy sign, which is where you press on the edge of the liver. Take a deep breath. Does that cause pain?
A little bit.
So at that point, she does have a little bit of pain, so that would need further investigation. And then for CVA tenderness, I'll have you sit up. Do you still have your gallbladder after having a baby?
Yes.
Any tenderness whenever I do that? And she is negative for costovertebral angle tenderness. Okay, and then we will move on to the neurological assessment. So I'm going to have you close one side of your nose, sniff, and then do the other side. So the nares are patent, and then I'm going to have you close your eyes. Okay, can you smell this?
Yes.
What is it?
I don't know. A pumpkin or something.
Close your eyes, please.
Awkward as you.
I picked those because they're her favorite. So cranial nerve 1 is intact. And then we did cranial nerve 2, the optic, and we will test the oculomotor now. So follow my finger with just your eyes. Okay, cranial nerves 3, 4, and 6 are intact. And then cranial nerve 7, I'll have you raise your eyebrows, puff out your cheeks, show me your teeth. Cranial nerve 7 is intact. And then cranial nerve 8 is the whisper test. So I'm going to whisper a word behind your ear and I'm going to have you repeat it, okay?
8. Taco.
Cranial nerve 8 is intact. And then cranial nerves 9 and 10, we did that whenever we had her open her mouth and say ah to look for the soft palate and pharynx movement, and those are equal. And then cranial nerve 12, the hypoglossal, I'm going to have you stick your tongue out and move it side to side. Okay, cranial nerve 12 is intact. Cranial nerve 5, I am going to clench your teeth. Clench your teeth again. Okay. Cranial nerve 5 is intact. So then we will move on to sensory. So I'm going to use a Q-tip, and I am going to I'm going to have you feel this, and it should be a soft touch, okay? So let me know if you feel it. Close your eyes.
Yes. Yes. Yes.
Okay, cranial nerve 5 is, or sensory is intact, and sensory for light touch is intact. And then I'm going to have you raise your sleeves up, push your sleeves up for me. Okay, close your eyes. Do you feel this?
Yes. Yes. Yes.
Okay. And then I'm going to have you keep your eyes closed and let me know if this is sharp or dull.
Sharp. Dull. Sharp. Dull.
Okay. Her sensory is intact. And then we're going to test your gag reflex. Do you have a sensitive gag reflex?
Oh, no.
Okay. Want me to stick your tongue out? Okay, so she does not have a sensitive gag reflex, but you always check to make sure because some patients have a very sensitive gag reflex. Also with the pain sensation, if that's abnormal, you can do the temperature test where you take warm and cold water and touch different areas of their body and have them differentiate with that. Okay, so we're going to move to proprioception. Okay. Keep your eyes closed. So I'm going to move your toe up and down, okay?
Okay.
What direction is your toe?
Down. Up.
Okay. Proprioception is intact. And then for vibration, you would have her close her eyes, and then you strike a tuning fork. You place it over the distal interphalangeal joints of fingers and of the great toe, and then ask the patient to let you know whenever it stops. Okay, so we are going to move to stereognosis. I'm going to have you keep your eyes closed and hold your hands out. Other way, like this. I'm going to put something in your hand and you let me know what it is, okay?
Pen light. Tongue depressor.
Okay. And then graphesthesia, I am going to draw something on the palm of your hand and you let me know what it is, okay?
8. A. T.
It was the number 7, so.
Oh.
Is
I feel like that's close.
it?
Yes.
And then, I'm thinking. So, I'm going to have you close your eyes. Okay, I'm going to touch an area of your body, and then I'm going to have you open your eyes and point to the area that was touched, okay?
Okay.
One more time. Okay. So her point localization is intact. And then so for the meningeal sign, you have them lay supine and then you check their neck mobility. And then for the Brudzinski sign, you have them flex their neck and watch for flexion of their hips and knees. For the straight leg reflex or straight leg raise, you have them lay supine, and then you passively raise their leg and dorsiflex the foot. And then, then we would move on to deep tendon reflexes. For the upper extremities, the bicep, I don't have a reflex hammer, but for the biceps, you have them flex their arm with their palms down. And then the thumb over the bicep tendon, you strike your thumb looking for the reflex on both upper extremities. And then for the triceps, you have them place their arm down, and then you support it and you strike above the elbow on this end. And then the brachioradialis, you pronate their forearm and then you strike the radius 1 to 2 inches above the wrist. And then for lower extremities, you do the right at the patella bilaterally. And I believe that is all for my head to toe.